Hi, my name is Robert Robinson. I'm 55 years old, living in Houston, Texas. I'm here today to share my testimonial on my recent acid reflux related surgery conducted by Dr. Elias Dorito of Houston Heartburn and Reflux Center. I had my surgery conducted in January 2023, and we are now almost 7 months post-surgery. So the point of this message is to share a little bit of my experience with acid reflux, some of the symptoms I had, why I made the decision to seek out a surgical solution, and also share some of the experiences that I had with the surgery on the lead up and on the recovery, and where we are almost 7 months after. I started having acid reflux symptoms around about 2016, and it was very mild. It presented itself as throat clearing, cough, slight burning throat, but heartburn was not a major symptom of mine. I had an endoscopy conducted, and I was essentially prescribed PPIs at that particular time on an as-needed basis. So this continued over the next number of years, and I had further endoscopies, and essentially the issue did not go away, even though I continued on an exceptionally clean diet as far as reducing acid related food content is concerned, reducing caffeine, coffee, all the normal things that you do when you're diagnosed with having acid reflux related symptoms. So moving forward, the symptoms got progressively worse, and I personally decided to seek out to see if there was a surgical solution out there. I did not want to continue relying or taking medication if there was the potential for a surgical solution moving forward. I found Houston Heartburn and Reflux online, and looked at some of the postings, including the patient testimonials, and is one of the reasons why I said to Dr. Dorito why I would do this testimonial. I think it's important to give feedback because the previous testimonials were very helpful for me from previous patients, and ultimately it allowed me to gain confidence in what would potentially be the surgical solution to resolve the problem. So I found Dr. Dorito and organised a consultation with him. I explained all the symptoms I had, how long I had it, and he agreed or suggested we do some testing to essentially assess my personal condition. We had an endoscopy undertaken. We had a pH Bravo test. We had some manometry testing conducted, and although the pH Bravo test was negative, both the biopsy from taken during the endoscopy and the subsequent manometry testing did confirm, number one, inflammation of the esophagus, and number two, reduced esophageal function, which, as Dr. Dorito explained to me, confirmed that I did have gastroesophageal reflux disease, GERD. So with that in mind, I took that under evaluation. It took me quite some time to think about this. Having surgery or pursuing a surgical solution is a very much a personal decision. And again, I had many other questions to ask. I had a series of subsequent consultations with Dr. Dorito, who on each occasion was very clear, very concise, and answered the questions really all about the nature of the procedure, what's involved in the procedure, the success rate of the procedure, the recovery, the diet, and what I could expect in terms of results post-surgery. So with that in mind, we had the surgery conducted in January this year, January 2023. I had the surgery conducted by Dr. Elias Dorido. It was conducted at First Surgical Hospital here in Houston, which I have to say was an excellent facility with wonderful staff, and it involved a one-night stay in the hospital. My procedure involved, I did have a hiatal hernia. I forgot to mention that earlier on during the endoscopy. I did have a hiatal hernia, and so that was repaired in conjunction with the Nissen fundoplication. In other words, the Nissen wrap that I'm sure many of you are at least heard of or maybe familiar with. So I had the combined procedure conducted in January, and I'm very pleased to say that was released. It involves a one-night stay in the hospital. I was released the following morning after a barium swallow test conducted by Dr. Dorido. He was comfortable with what he's seen post-surgery, and I was released the following morning. The recovery can be a bit challenging. It is a 6-week period, and it's, I did lose 22 pounds during that period. I haven't gained all the weight back again yet, but I'm very well on track to get back to my normal body weight. But in my personal circumstance, I've always found it difficult to get the weight back on. So it's just taken a bit longer for me. But I've been in to see Dr. Dorido on a couple of occasions since the surgery, and very pleased to say that everything has gone as Dr. Dorido predicted and as planned. As I say, we're almost 7 months post-surgery, and if I look back at my symptoms prior to the surgery and where we are now, I can only convey that I'm so happy that I had the surgery done, because the outcome has exceeded my expectations. I no longer have constant throat clearing. I no longer have a burning throat. And in general, I just feel a whole lot better. As I say, heartburn was not a previous symptom of mine. I know that for many people suffering from acid reflux, heartburn is one of the major symptoms. It wasn't a major symptom for me. The burning throat was the main symptom for me, along with coughing and constant throat, or almost constant throat clearing, particularly in the mornings. All those symptoms have gone. The medication, the over-the-counter PPIs, was stopped just prior to the procedure, and I have not taken PPIs since the procedure. As I say, the absence of the symptoms is just it's a fantastic change from the symptoms that I had before. So in wrapping up, what I would say is that I am extremely happy. In fact, I can't put into words just how happy I am post-surgery. As I say, it was a long period for me, suffering from acid reflux for circa 7 years. As I say, it was very mild in the beginning, but did get progressively worse, to the point that prior to the 2 weeks prior to the surgery, or 3 weeks prior to the surgery, I had refluxing for a couple of weeks, and it really was intolerable. And at that point, really needed to have the surgery. As I say, this testimonial is to help those of you out there that is potentially looking for a surgical solution. As I say, it's very much a personal choice, so all I can do is share my experiences, and so far it's been extremely positive. I was delighted to meet Dr. Dorido and his team, and I'm very thankful for the surgery that was conducted and the results that we have seen since the surgery. So I wish you all good luck. As I say, if you are suffering from acid reflux, then I would highly recommend that you seek out and at least explore a discussion or a consultation with Dr. Dorido. And again, he can listen to what you've got to say, evaluate your symptoms, and then, as I say, it's a personal choice between you and your doctor, whether Dr. Dorido, whether a surgical solution is right for you. I'd like to take this opportunity in closing to again wish all of you out there good luck. I'd like to convey my sincerest thanks to Dr. Dorido, very much an expert in this area, and I'm very grateful that I came across him, and I'm very grateful that he conducted the surgery on me. And a big thank you to all the staff at Houston Heartburn and Reflux Centre, and also a big thank you to all the staff at First Surgical Hospital who provided a fantastic facility for the surgery. So once again, good luck, and Dr. Dorido, many thanks indeed for all your expertise and both your very detailed explanations both prior to and post-surgery. Thank you.